I'm Rob Lerner. I'm a gastroenterologist. I work at DMC. I've been here since 1988. Been here a long time. Well, I think most of the doctors are all on board with the vaccine, certainly the ones that are over 35, 40 years old. The risk of the vaccine is felt to be fairly negligible. They have lots of numbers where very few side effects, very few serious side effects, versus the effects of corona are obviously much more severe. And in my age range, there's certainly a chance of dying and having some kind of chronic issue that goes on for months. I've seen enough people, even my friends have had it, that they admonish me they just don't want no part of getting that infection. So I've had both shots. I had a little soreness in my left arm after the first shot. Some people have told me they felt bad for a day or so after the second shot. I didn't feel anything. I had no problems whatsoever. Most of the people I've talked to had no problems whatsoever. So the risk of the vaccine, in my estimation, is so negligible compared to the risk of getting the virus or getting some chronic illness related to the virus. It's just a no-brainer. It's maybe a little harder call for some of the younger folks. I kind of get that. But even if they don't get seriously ill, they have such a high chance of spreading it to their parents or their grandparents or their children. I just don't understand why there's been such resistance. And in addition, it's almost a public health measure that even though you don't want to do it, maybe there's a little reluctance to everybody getting some form of new vaccine. The country's not going to get control of the pandemic until a huge percent are vaccinated. So they didn't ask for people's opinion when they got a polio vaccine. They just put you in line and gave you a polio vaccine because that's what they had to do to control the disease. Same thing when you take your kids to school with measles, mumps, rubella. It's just not an issue. You have to be immunized to help protect other people. To me, it's the same thing here. You have so many people devastated by this illness. We're not going to get it under control until a vast majority of the population is vaccinated. So it's a public health measure. It's a public service thing you're doing. Even if you don't want to necessarily protect yourself, you're protecting everybody else around you and doing the right thing as a citizen.